Hey everybody, welcome back to my channel for episode number 6 of my VCP and Me series called VCP Explained. This is part 3. In today's video, I'm going to conclude my discussion with Dr. Virginia Kimonis, and we're going to be talking about diet tips. We're also going to cover the federal right to try law. We're going to talk about CRISPR a bit. And then what's really important now is the VCP patients and COVID-19 and how COVID-19 impacts VCP patients. And then any impacts on the family. And then we're going to finish up with some final thoughts from Dr. Kimonis. Dr. Kimonis is a professor with the Department of Pediatrics in the Division of Genetics and Genomic Medicine at the University of California, Irvine. She is very involved in the VCP community and is on the medical advisory board of Cure VCP Disease, Inc. Yeah, so as far as diet tips for VCP patients,
So there currently is no control study that has been done for VCP disease in terms of what diet works for patients in improving the symptoms. But what we have learned from our animal work, in which we created mice that had 2 mutations. They didn't have any normal VCP mutation, and these mice died by 3 weeks. But when we fed the pregnant dams, their mothers, prior to getting them pregnant, a high-fat diet. So this was just soybean oil that had 9% fat versus the normal 6%. These mice not only survived, but they were actually stronger than their litter mates. And many have survived up to 2 years, so full length, even though they're tiny.
oh wow.
So this is clearly a study that needs to be done in patients. When we analyze what was in this high-fat chow, it was mainly made with soybean oil. It's very difficult to cook with soybean oil. It has to be supplemented in food. And I do recommend individuals to supplement their salads, their cooking with soybean oil. You can't cook with it, but really no control study has been done. In our mice, we had also given them a ketogenic diet. So we increased and decreased the amount of fat in their diet. And we found that the amount of fat that was helpful had a very narrow margin. So around 9% to 12% fat content seemed to be the best in terms of prolonging survival. But this particular proprietary chow that we fed our mice, it's been very difficult to replicate it by ourselves. So we had also treated mice in order to make these homozygotes survive beyond the 3 weeks when they normally would live, with giving the pregnant dams different types of oils, such as safflower, coconut, corn, etc. And we really didn't find that those different fats were particularly helpful. But generally, a Mediterranean diet is considered helpful. It contains polyunsaturated fats rather than saturated fats. It contains a lot of olive oil, and also supplementing with vegetables, salads, low carbohydrate diets, grains, legumes, nuts, which are high in unrefined sugars. They're all considered good for you. Keeping your weight down, exercising is also really important. Until a treatment comes along that is definitive, we need to stay healthy and try and not smoke, not do drugs, alcohol in excess. Those are all harmful that we know.
Yeah, so I mean, because I've had a couple of questions regarding diet,
Mhm.
specifically like I was interested in protein content. And secondary to that, it is plant-based protein versus animal-based protein, better or worse. And I don't know if um, any studies in the past or anything done related to VCP. I
Right.
know there hasn't been anything VCP direct.
So we did a survey. So this was a quality of life study. It didn't really split the types of fats that I recall into whether it was animal or vegetable based, but generally animal protein is accompanied by saturated fats, which are generally considered harmful. So vegetable-based proteins and vegetable-based oils would be what you would find in Mediterranean diets and would be considered more healthy than animal-based protein and fat. But I don't know if anybody knows the answer to this question, Todd.
But yeah, I think it's a really good question though, and something that some of the people who've watched my previous videos and know about my condition have asked, and some asked me on the Facebook thread to my part 2 video, since you mentioned drugs, marijuana and CBD and hemp, um, there are, well, I don't partake. I've been told that there are some unofficial marijuana trials going on with some VCP patients.
Right, right. What I can
Very
share with
curious on
you,
your thoughts with
yeah,
that, but
sure. So what I can share with you is that although, again, this study has not been done, many patients with VCP disease do experience pain.
mm-hmm.
They have charley horses, they have difficulty sometimes sleeping, it's pain in their muscles, pain in
Yep.
their periphery. And I also treat other patients that have very painful diseases, and the standard medical treatment doesn't seem to work as well as marijuana or combinations of THC and CBD. So I
Mm-hmm.
know many of the patients with VCP disease do rub CBD oil with some benefit, and it's pretty safe. CBD is not harmful
Yeah.
like THC, but generally the combo of THC and CBD seems to work better overall for most people.
Partake of it, but I've had those pains. I've woken up in the middle of the night with my legs cramping to the point where I'm nearly crying.
So that's a study that needs to be done as well, really, looking at how much pain people experience with VCP disease, because that does alter quality of life, having chronic pain. And if something can be
Mm-hmm.
done about it, it's going to improve, the
Okay.
quality.
The right to try laws, do they help at all with speeding along research or the ability to utilize, medications for VCP patients?
Yeah. So what I understand, Todd, and I'm not the expert, is that you have to still go through the process of getting a drug approved by the FDA. And then once it's approved, it can be used for other indications. Uh, I, I don't really know how FDA views the right to treat when they're dealing with a drug that has not been approved. So
I went through and I found the actual the text of the law, and I looked at some interpretations of it, and it's not very straightforward. And there's the federal right to try law, which I believe was signed in 2018.
right.
And then there's also individual state right to try laws, which vary.
As I said, when I tried to leverage that right to try law, I didn't get anywhere because they said, yeah, we know that it's a law, but nobody's given us any guidance as to, how to act on it. So
Mm-hmm.
it was signed into law in 2018. It's a way for patients with life-threatening disease who've tried all approved to access, it says, to access certain unapproved treatments. So for patients with serious or immediate life-threatening disease, the FDA remains committed to enhancing access to promising investigational medicines for those unable to access investigational products through clinical trials. This is the mission of our expanded access program. Yeah, but when I tried that expanded access program, they just said that it has to still go through the rigorous approval system.
Yeah, because when I was doing research, a lot of the comments basically said that really nobody knows what to do with this, and it doesn't seem to be widely understood even by those within the FDA.
So it says an eligible investigational drug is an investigational drug for which a phase 1 clinical trial has been completed that has not been approved or licensed by the FDA for any use, for which an application has been filed within FDA or is under investigation as in a clinical trial that is intended to form the primary basis for a claim of effectiveness in support of FDA approval and is the subject of an active investigational new drug application. I mean, it's certainly whatever, when I had put in my application, it certainly fell into all of these criteria, but they absolutely slammed it.
So it doesn't sound, at least right now, that it will help us very much. So how about CRISPR? And can CRISPR help?
So CRISPR technology has actually been really useful to make animal models of various diseases, and it has sped up that process enormously, and the cost as well has come down drastically compared to what we used to have to pay to make animal models. And that's been a great advance because now we can make models of specific mutations and actually do personalized medicine. However, it is different when you're talking about introducing CRISPR in vivo into the human, because there are concerns from CRISPR. There are untargeted effects, and you can damage genes that are really critical and vital. So the problem is that there are real concerns about the off-target effects. However, technology is improving, but technology has been used successfully for different disorders, most successfully in disorders in which you can remove cells for disorders like sickle cell disease and then introduce it back in again, cancer, sickle cell disease. However, it is different with neuromuscular disorders in which you have to introduce the CRISPR into the muscle. However, if one is successful in getting to convert the cells, muscle actually would be a great organ because of the very slow turnover. So the effects would presumably be long lasting. Right now, a lot of research needs to be done. CRISPR and other technologies like gene therapy holds a lot of promise. And we need to definitely be aware of what's going on in the research community and try and leverage the advances in technology to be applied to VCP disease.
How COVID impacts VCP patients, and are VCP patients of higher risk due to COVID?
So luckily, I'm not aware of any VCP patient who has been infected with COVID, but the incidence is rising of COVID throughout the country, as we all know. And so it's just a matter of time for a patient to be affected by COVID. Because VCP disease is associated with generalized muscle weakness, diaphragm weakness, COVID poses much greater risk in an individual with VCP disease. And so it's very important to prevent getting VCP. Social distancing, staying at home, I would strongly recommend that for patients with VCP disease. Staying as healthy as we can until a vaccine comes along, and we hope that'll be very soon.
Do you think exercise can help, people, build up immunity or help them, with COVID? It's something I've been thinking about because mentally and everything. We talked last video about exercise. Could that help with COVID?
Sure. So again, the study has not been done in VCP patients on the benefits of exercise. I have conducted a respiratory resistance training exercise in patients with a very similar disorder, Pompe disease. And I was very impressed at the benefits compared to the natural history data in
Hmm.
patients with Pompe disease. So there are devices that can be used to build up resistance by breathing against graduated resistance in the devices. And it is hoped that patients with better respiratory capacity might be able to withstand COVID better
Hmm.
than not, because we know that VCP disease does affect diaphragm and intercostal muscles that control your breathing.
Well, that's good to know because that I need to keep exercising because I do
No
want to.
easy way. I wish there was a shot we could take and not have to exercise.
How VCP impacts the family. You know, obviously it impacts the patient and has impacts to a caretaker, spouse, other family members. But um, can you give a little bit more insight on that?
Sure. So VCP testing, we can talk about pre-symptomatic testing first. So
Hmm.
individuals who are related to a member who has VCP disease can choose to be tested pre-symptomatically and learn about their potential for inheriting the gene. So a person with VCP disease passes it on to 50% of their children. So the mutation on chromosome 9 is on one of the copies, and there's a 50-50% chance of passing it on to
Hmm.
their children. So testing is generally offered to individuals over the age of 18. We recommend genetic counseling because it's something that has to be done very sensitively, very safely. There are some people who do terrible things, when they learn about a neurodegenerative disorder that may also include dementia in some folks.
Hmm.
Dementia, of course, is only seen in a third of patients, and it occurs right at the end of the natural history of the study. Now, what you're referring to is prenatal testing. So, testing of the fetus. And again, what we recommend is that the couple, before they're planning a pregnancy, should meet with a genetic counselor prior to getting pregnant so they can learn about their mutation, learn about what strategies can be used to learn about the pregnancy, what the risks are, and if they chose to prevent having a baby that carries the
Hmm.
familial mutation. And we call that pre-implantation genetic diagnosis. So you need to know that that person has a mutation, and then you generate embryos that don't carry that mutation, which can be implanted by in vitro fertilization. That family planning is a very personal thing. There are some families who have families. Some families decide not to have children, and some families try hard to have a child that doesn't carry a mutation by pre-implantation genetic diagnosis. So we definitely recommend speaking with a genetic counselor. And I'm always available to help patients as well. And I have helped families with pre-implantation genetic diagnosis.
No, that's good. I mean,
Mm.
it makes me thankful that my wife and I consciously made the decision not to have kids, and we did this long before I knew I had VCP. Um, you know, we were young. I mean, when we started dating, we were in our early 20s, and we made that decision. And everybody says we would change our minds, and we never did, and we have no regrets to this day. Especially now that we know, the VCP diagnosis and what the impacts are. So with that, I mean, I know we're running out of time here. Do you have any final thoughts?
My recommendation is to always have a positive frame of mind,
Hmm.
be involved, signing up for the Cure VCP registry, being involved as much as they can. Cure VCP holds lots of education and social sessions. Unfortunately, the conference that happens annually was canceled because of COVID,
Hmm.
but involving themselves in fundraising because research takes a lot of
A lot of money.
resources. Education and outreach also is expensive. Printing up brochures, attending conferences, but those are very important things to increase awareness. And then participating in clinical trials, really trying to lobby the FDA if possible, when it's pertinent, to have trials approved, such as the one we tried to do with CB5083 by Cleve Pharmaceuticals. And hopefully there will be a treatment such as CRISPR or gene therapy or some magic drug that will revert all the complications of the VCP mutation.
Yeah. Well, again, thank you very much, Dr. Kimonis, for your time. Over these past several weeks, and I know personally it's been invaluable for me. The information's been fantastic, and I know everybody else has been incredibly thankful who viewed the videos and seen the information. It's been very valuable to them. So again, I want to thank you. Talk to you is incredibly beneficial. I really appreciate it. So thank you very much for your time. And
Thank
hey,
you, Todd. I
and
appreciate you doing this.
yep. All right.
Great. Bye bye.
Bye.